Hello everyone. If you suffer from back, hip pain, numbness into the legs, you're going to want to watch this video. We're going to show you how we do cold laser therapy to inhibit the nerves and Cox flexion distraction technique for the numbness in the legs and feet and toes. And we have a personal trainer here, Sherry Ann, who's been under our care for a couple weeks now. And she came in with really bad left hip pain and numbness in the legs. Still has some numbness in the legs. Discs take time to heal. They take about, on average, 3 months to heal. So sometimes symptoms can even take longer than that to go away. But typically, we see about 50% reduction in symptoms in 4 to 5 weeks. That's a typical expectation, especially with Cox technique. So you'll see here I have these wedges here underneath her. Those are there to put her lower back into hyperflexion or take it out of extension. So we're just tilting her pelvis back, the front of her pelvis is back, and putting her back here into into flexion out of hyperextension. So what I'm going to do with this laser is I'm going to check for areas of inflammation, because this is a MR5 Active Pro laser, and I'm able to tell areas of inflammation with this and soft tissue damage. So we're just going to scan across this left side. And when you hear it beep, that means there's either inflammation or soft tissue damage. We don't know which. It doesn't tell me that. It just warns me that there's either of the two going on there, and then it tells me how long to dose it for. And then we usually run it over that same spot again once or twice, just to make sure. And here we go. Now, the reason for her numbness in her toes, specifically the outside toes, is because she probably has a disc herniation or a disc bulge. Now, the only way you'll know if you have a disc injury is by MRI. Also, a CT scan can show that, but MRI is the preferred test. And we have not done an MRI yet on Sherry Ann. That's going to be next if she doesn't improve here in the next few weeks. She's already improved some, but we want complete resolution here. Have you seen a 50% improvement yet? More?
More than 50%.
More than 50%, okay. So then we're on the right track. Remember I said our expectations should be minimum of 50% improvement in 4 to 5 weeks. So we've achieved that with her left hip. She still, though, does have some of that numbness and tingling in the leg. Has that resolved 50%?
I would say about that.
About that, okay. All right, so we're on the right track, and we still may get her that MRI. The MRI just helps us get in there and give us that definitive diagnosis, and it gives us a closer look at the discs in the spine, and nothing can replace an MRI. It's sort of the gold standard when we're looking at the spine closely. So right here, the multifidus muscle in a few spots has beeped. So there's some inflammation or soft tissue damage there. And then we're going to run it over the glute where the piriformis muscle is, where the sciatic nerve exits, to see if there's any inflammation there. Because right through that piriformis muscle runs the other nerves that would control the sensation, numbness, tingling in her toes and feet. So we want to make sure we're thorough here. Okay, done dosing that spot. And then we're going to come down. So I'm just going to lower this here. Good. So now I'm scanning over the piriformis. And there we go. There's a few other spots. So when somebody's dealing with sciatica or any kind of neuropathy in the leg or numbness, tingling, paresthesia, it's called, That was quick. We're going to scan it over that area again just to make sure. That's exactly why I like to go over it 2 or 3 times. So there's a few other spots here at the bottom where the butt meets the hamstring. Right here, you'll see me point my finger, and then right here in the middle of the hamstring is another spot. So we're going to go ahead, just hold it there for a minute. And it beeped right on the spot, right over the sciatic nerve right there. So for me, I know where these spots are. I don't need this sensor, but it is helpful when you're using it over large areas. So we're just going to slide this down to the middle of the hamstring here. And then to do it right above the knee, about an inch above the knee, right in the center. And then sometimes if it's really bad and the sciatica gets all the way down below the calf into the foot and the toes, you want to put it right here in the middle of the calf or the gastrocnemius muscle. So we do about a minute. This is a 50-watt laser, so this laser treatment times are pretty quick. 50 watts about as strong as they get, as far as I know. So we have 25, 15 watt, we've got all different types, and it really just depends on the treatment times. That's what the wattage does and tells us. So now we're gonna go all the way down. I'm gonna slide it back up here, okay? And we're gonna slide your pant leg up. Good. And we'll do a minute here. And then after this, we're going to go ahead and do some cox flexion distraction for her and some ART on the glute. The ART on the left hip tends to help her a lot, so we're going to definitely show you how we do that. How you doing, okay?
Good.
You probably don't feel a thing. That's normal. And then we're going to go right back here to the calf muscle. And I'd like you to let me know how it is over the next 12 to 24 hours after we did this today, okay? 30 more seconds. Okay, since we've already tolerance tested Sherry Ann, meaning we've done the flexion distraction technique without the cuffs, and now we're well into protocol 1 here. The next stage here will be to get her an MRI. She also has a little bit of numbness and tingling in her arms and hands. So we're probably going to need to do an MRI of her neck, her cervical spine, to take a closer look at those discs as well. But that doesn't seem to be as much of a problem, right?
No.
As the lower back and the leg.
Correct.
Okay. And this technique is very gentle, but the idea here is to open up the space where the nerve exits from the spine, called foraminal encroachment. When it's enclosed, we're going to do foraminal gapping. We're going to open up that space, that gap. And we got a little bit of motion right there. I don't know if you felt that. Then we're going to add about an inch or 2 of traction. See here with my foot, you can't see my foot, but there's a little pedal down here. I'm able to distract the table out a little bit. So we're able to add a little bit of traction with flexion distraction. And this technique is going to be instrumental in you recovering from this. Being put on your side posture, is probably not the best technique for you, okay? But that being said, an MRI should be done just to make sure. I'm not saying that you can't get benefits from side posture adjustments. You can, but it's probably not the ideal technique. Okay? So once we get an MRI, we'll be able to confirm that. Any numbness down the leg when I did that?
Nope.
Good. Now sometimes we have to put a patient on the side. We can even do cox flexion distraction technique on a patient laying on their side if they just can't lay down on their stomach, which I've had that happen before. So now she has a little bit of a scoliosis curve as well. And take a deep breath in, bend your knees. Good, and blow all the way out. Drop your legs down. And again, deep breath in. And blow all the way out. Relax here. You're stiff today, huh? All right, let's have your left side up or left hip up. Lay on your right hip. Nope, other side. Okay. So we're going to do a little ART here. Go ahead, swing that leg forward. Bring the thigh all the way back against my leg. Yep, and forward. Good. And forward. Good. And forward. Excellent. Good. Is that painful? Good. Excellent. Okay. Let's have you sit up and face me. And you're going to sit on this cushion. So we're going to do a little more ART on this left side. So you're going to cross your arms in front of you. Remember this one? You're going to laterally bend and bring this shoulder that way. Remember that one? So no, laterally bend. And then you're going to come up and go forward like that. And then up to neutral. And then laterally bend and go forward. So right now I'm going to do ART on her QL and her multifidus. Okay, go ahead. Good. And again. Good. So it's really important to do not only soft tissue work, but the adjustment, the flexion distraction technique, and the laser. She's getting all three. Laser inhibits the nerves, reduces inflammation, reduces spasms. So does ART. It increases mobility, increases blood flow to the area, and the adjustment takes pressure off the nerve, stretches out the facet joints, opens them up. Good. Good, and one more. Excellent. All right, now lay on your back. I'm going to check your psoas muscle. Psoas muscle attaches to the hip joint, so we want to check that. Hands up in the air. Yeah. Okay, and looks like your psoas is tight on the right. Sensitive in there?
Yeah.
That's tight. Bend this leg. Good. So a lot of doctors, I'll tell you this, if you have back pain, especially back pain shooting down your leg, and you see a chiropractor more than a handful of times, and he doesn't go right here into your stomach, just below your, and the lateral to your belly button, then he's missing a lot. This is the psoas muscle, and this is the only way to get to the psoas muscle, through the stomach. It is a back muscle that attaches onto the hip. It's a hip flexor, and it also attaches onto the spine, the lumbar spine. So she can probably feel this in her back, right? Yeah. Much harder to feel in people that are overweight, obviously. Thin people, you can feel all the way through the stomach, and I can feel the whole psoas here right up alongside the spine. And I'm not using much pressure, but it's very sore for her. And one of the ways I checked it was this arm check. It doesn't work for everybody. It works for her, for many patients, but not everybody, especially if they have a shoulder problem. And we're going to see this arm balance out now. Yep. Great. Relax your arms there. Now, which fingers have gone numb for you? Do you notice? Is it your big finger, your thumb, or your index finger, or is it the pinky finger?
I feel more the pinky, but
Okay.
generally all of them.
So the reason I asked her that is because each nerve has a dermatome, an area that it controls, and tells me a lot about which nerve could be pinched or which could be compromised. So C7T1 we just adjusted. Look at that. Hands up in the air. All right, you're all set.
Thank you.
You're welcome. Thank you for tuning in.